What is up, working people? We are back to work. Yay, lucky me. Good news is that I'm feeling good enough to be here, man. So I'm happy to be back, be here supporting my coworkers. Management did nothing to help carry the load while I was out. So all my coworkers got buried with my extra work. That's just the way of things nowadays with staffing crisis the way it is. But we're back, we're getting cleaned up, we're back in action, and we're taking our break and we're talking about affordability. All this week we've been talking about it. Started with wages not keeping up with something, housing, groceries, everything. Today we're going to talk about healthcare, something we all need, quite honestly, something we all deserve, right? Healthcare, human right. Housing, human right. Food, human right. It's not on you to grind out the worthiness the worthiness required from the bosses to be fed, to be housed, to be healthy. All of those things being on our backs is why I keep saying, like, this is just another form of slavery, right? You're not free if you're stuck in a wage labor job to get those things, right? Healthcare specifically, costs are out of control. Families, $27,000 a year it costs to cover a family now. All of these costs, these expenses, they're being pushed down on us. If you got health insurance at your job or health coverage, part of the reason that you're not getting living wages is because your company is paying for that health coverage. We need to detach those things. We need to take our healthcare away from our jobs and away from our unions and stop letting that be a point of leverage that they can use to keep us from gaining living wages. Healthcare, human right. Healthcare costs have risen by over 6%. Our wages have only risen by 4%. Every year that goes by, our health gets more and more out of reach for us. There's GLP-1 drugs right now, those injectable weight loss drugs. Those are driving up the cost of healthcare to astronomical prices. Guess who can afford that? Wealthy people. Guess who that impacts? Poor people. It means we can't get the drugs and the care that we need because the costs are so high to subsidize those GLP-1 drugs. All of a sudden, none of us can afford our healthcare. This is a major crisis, and we can fix it with our union. Shout out to my union. I know I criticize them a lot on this channel. One thing I do appreciate is my union insurance. One thing I don't appreciate is my union throwing that in my face as a reason why I can't have a living wage. Decouple those two things. Our healthcare is a human right. The affordability of healthcare is not our problem. Why don't we take profit out of the healthcare system? Why don't we watch the costs come down when there's not people making billions and billions of dollars off of keeping us sick? That sounds like a pretty good idea. Look into it yourself. I've started to share some of the statistics that I look into when I'm exploring these ideas. And these are just conversations, and we're having them right here on this channel. So add your voice in the comments. We'll keep talking about it. Peace and solidarity.